Welcome students back to exercise 13. In this lecture we're actually going to go through the different parts of the body and the different muscles that you should know in those parts of the body, starting with our facial expression muscles. And the facial expression muscles actually have a kind of an interesting thing that occurs with them that other muscles don't have, in that they insert actually onto our skin or into other muscles. So they don't actually insert and attach to the skeleton that way. They might originate there, but they're going to insert onto skin or other muscles. And all of the kind of wide range of facial expressions that we have, the fact that we can smile and pout and kind of show surprise and look angry, and all of those kinds of facial expressions that are really, run the whole gamut of our emotional life on our faces, can show up on our faces due to all of these different facial expression muscles. So we'll start with the epicranius muscle. The frontalis is the muscle that allows you to raise your eyebrows. The occipitalis acts as a fixator. So the occipitalis contracts, that pulls the kind of scalp of your head kind of towards the back of the body. That fixes and immobilizes the origin for the frontalis, that epicranial aponeurosis, and then the frontalis can contract and you can raise your eyebrows. The orbicularis oculi is a round muscle surrounding your eye. It lowers your eyebrows and is also responsible for the blinking motion of your eyes, so it closes your eyes. You have two zygomaticus muscles, major and minor, on both sides over the zygomatic bones. They kind of pull up the corners of your mouth kind of laterally, so when you smile, you are using your zygomaticus muscles. You also then have a muscle called the depressor anguli oris. Oris means mouth, so depressor means down, and anguli means angle, so we're pulling down the angles of your mouth, so we're drawing your mouth downward. So when you frown, you are using the depressor anguli oris muscle. The orbicularis oris muscle is a round muscle surrounding your mouth that is responsible for closing your lips. And so when you kiss and you make the little fish face, kissy faces, you're using your orbicularis oris muscles. The buccinator is a muscle in your cheek that you use when you whistle or if you're sucking fluid through a straw. So it kind of compresses those cheek contents. So if you can whistle really well, that means you have pretty well functional buccinator muscles. I personally can't whistle worth a damn. If we look at the muscles of mastication, the process of mastication is chewing. So what muscles do we move when we chew? The prime mover for closing your jaw, so closing your mouth, is the masseter. The temporalis actually acts as a synergist for closing your mouth. It is also responsible for kind of maintaining your jaw position when you're kind of not doing anything, when it's just at rest. The digastric is a muscle on the underside of the neck that is responsible then for opening your mouth, opening your jaw. And then you also have these pterygoid muscles that attach to the pterygoid processes of the sphenoid bone that are responsible for that kind of side-to-side lateral excursion that your jaw can do in order to grind your food to help you chew. If we then look at the neck muscles, we're looking at the sternocleidomastoid muscles. You have one on each side of your neck. When they work together, that allows you to flex your head forward, so the flexion of your neck. But when they work opposite each other, when they antagonize each other, they cause rotation of your head. And then the splenius muscle is a muscle in the posterior that causes extension and, of course, then hyperextension of your head and neck. So let's take a look at those. So you can see here's the epicranius, the occipitalis here over the occipital bone, the frontalis here over the frontal bone, the temporalis over the temporal bone, orbicularis oculi around the eye, the zygomaticus major and minor muscles for smiling, the buccinator muscle here, orbicularis oris for around your mouth, depressor anguli oris here for kind of frowning, the masseter here for chewing, the sternocleidomastoid muscle here, and then this muscle here, the platysma, and here's you can see the splenius for pulling your head backwards. The platysma actually tenses the skin of your neck, and it is more superficial than the digastric, so you can't actually see the digastric here. You would have to strip away the platysma here. If we look at our anterior trunk muscles, we're going to look really starting with the muscles for breathing. So the prime mover for breathing is the big old dome-shaped muscle called the diaphragm. But then the external intercostals are synergists during inspiration, and the internal costals are actually synergists to the diaphragm when you have to like forcefully exhale. If you're just kind of doing a normal breath, then it's really just the contraction and relaxation of the diaphragm and external intercostals. But if you then have to kind of forcefully exhale, then you have to add in those internal intercostals as well. So you can see here's the diaphragm, external and internal intercostals. If we look at postural muscles, we're talking about muscles then posterior, muscles in the back, and we're really talking about one big muscle group called the erector spinae. I love that one, erector spinae, erect spine. So that's when it is going to be causing extension of your vertebral column. So it allows you to stand up straight, right? It's actually three muscles as part of the erector spinae group: the iliacostalis, the spinalis, and then the longissimus. So the iliacostalis and the longissimus also help cause like lateral flexion. So if you're ever doing those movements where you're kind of like rotating your vertebral column, or not rotating, but when you're doing like I don't know what that movement is called, but like where you take your head, your arm, and you put it over your head to the side, that is lateral flexion. And this erector spinae muscles, or at least two of the three, also help with that. But erector spinae, erect spine, prime mover of vertebral column extension, so you can stand up straight. If we look at the abdominal wall muscles, we're looking at abdominis muscles. So we have the rectus abdominis, the internal and external oblique abdominis, and the transversus abdominis. So the rectus abdominis allows you to flex and rotate your vertebral column. The internal and external obliques are synergists, particularly when you're laterally rotating your vertebral column. And then the transversus abdominis actually is this wide strap of muscle that cuts across your abdomen and helps you compress the abdominal cavity. So you can see here is the rectus abdominis for vertebral column flexion. You can then see the external obliques here, and then the internal obliques here. The most superficial of the abdominal wall muscles are the external obliques. Then the rectus and the internal obliques are about the same level. And then the deepest of your abdominal wall muscles is the transversus abdominis muscles. So then if we look at shoulder muscles, we'll look anterior first and then posterior. If we look on the anterior, we have a couple muscles that help stabilize your scapulae. One of them is the pectoralis minor, that pulls the scapula kind of forward and down. And then we have the serratus anterior, which is also known as the boxer's muscle, which allows you to protract and abduct your scapula. So kind of hold it against the wall of the chest so that you can do kind of horizontal movements of your arm, hence boxer's muscle. We then have the deltoid, laterally over the shoulder. That is the prime mover for arm abduction. And then the pectoralis major, which is your prime mover for arm flexion. It also helps medially rotate and adduct the arm. So you can see here's the deltoid here, pectoralis major here, pectoralis minor here, and then the serratus anterior here. If we look at posterior shoulder muscles, we've got the trapezius that allows you to raise, rotate, and adduct your scapula. So when you're shrugging your shoulders, what you're using is your trapezius. We also have the rhomboids. They allow you to adduct your scapula. So like when you kind of square your shoulders so that your shoulders are back straight, you're using your rhomboids. And then we have the latissimus dorsi, which is the prime mover of arm extension. It also causes arm abduction and medial rotation, but its main job, of course, is to extend the arm. And then we also posteriorly have the rotator cuff muscles, and they do a whole bunch of stuff in terms of kind of moving the arm, but really kind of one of their main jobs is to be that main stabilizing force for your shoulder joint. There are 4 of them: supraspinatus, infraspinatus, teres minor, and subscapularis. So you can see here's the trapezius. You can see the deltoid again. You can see here are the rhomboid muscles, the latissimus dorsi here, and then some of our rotator cuff muscles: supraspinatus, infraspinatus, teres minor here, and then the subscapularis is actually kind of below the scapula on the other side. Can't see it in this picture. If we then look at our upper limb muscles, in the arm, we've got the triceps brachii, the brachialis, the biceps brachii, and the brachioradialis. So the triceps brachii causes extension of the forearm. The brachialis causes flexion of the forearm, as does the biceps brachii, which also causes supination of the forearm. And then the brachioradialis is a synergist to the brachialis and biceps brachii in terms of causing forearm flexion. So you can see triceps brachii here posteriorly, biceps brachii here anteriorly, brachioradialis here, and the brachialis right here, kind of just deep to the biceps brachii. If we look at the forearm muscles, we have the pronator quadratus. It's the muscle that is responsible for pronating your forearm. We have the flexor carpi ulnaris and the flexor carpi radialis. They're going to do wrist flexion. The ulnaris muscle causes adduction of the hand, and the radialis muscle causes abduction of the hand. So they're both synergists with each other and antagonistic to each other. We have the extensor carpi ulnaris and the extensor carpi radialis. They're going to cause wrist extension, and again, the ulnaris muscle will cause adduction of the hand. The radialis will cause abduction of the hand. Then you have the extensor digitorum, which is going to cause extension of the fingers, and the flexor digitorum. You actually have a couple of them. You have a digitorum superficialis and a digitorum that is deeper, but they're going to cause flexion of the fingers. So here, your pronator quadratus. See flexor digitorum, flexor carpi radialis, flexor carpi, ulnaris here, radialis here, extensor digitorum here, and then extensor carpi radialis, and extensor carpi ulnaris. If we look at the pelvic girdle muscles, we're looking at the iliopsoas, which are the prime mover for thigh flexion, and then the gluteus maximus, which are muscles that are going to cause extension of the thigh. The gluteus maximus is particularly active when you're climbing up stairs or you're running. You also then have the gluteus medius, which causes abduction and medial rotation of the thigh. It is a particularly important muscle for kind of stabilizing the pelvis when we walk. If we look at anterior thigh muscles, we have the sartorius, or the Taylor's muscle, which causes flexion, abduction, and lateral rotation of the thigh, as well as flexion of the knee. We have the gracilis, which causes adduction of the thigh, and then flexion and medial rotation of the leg, particularly during walking. And then we have the quadriceps femoris, which is actually 4 different muscles with a common insertion, which is the quadriceps tendon, which is going to go to your knee. And so the largest of these is the rectus femoris, which causes extension of the knee, as well as flexion of the thigh at the hip. And then the 4 kind of vastus muscles. You have the vastus lateralis, medialis, and intermedius, which are synergist to the rectus femoris, but they're going to cause extension of the knee. And that's the one kind of weird time where an anterior muscle is going to cause extension as opposed to flexion. So if the quadriceps femoris, the anterior muscle, causes extension of the knee, then the flexor muscle from the knee is actually going to be posterior. We can also look kind of medially in the thigh. We're looking at the adductor group, the adductor magnus, longus, and brevis. They're going to cause adduction and medial rotation of the thigh, hence adductor group. And then the hamstrings, which are the flexors for the knee. They also extend the thigh at the hip. There are 3 muscles in this group: the semitendinosus, the semimembranosus, and the biceps femoris. Again, kind of 3 muscles, but belong to a common muscle group. So you can see here's the iliopsoas. You can see here is the sartorius, which is the strap-like muscle here. It's also known as the talus muscle. Here is your quadriceps femoris. Adductor muscles here medially, as well as the gracilis. And then we look posteriorly, you can see gluteus medius, gluteus maximus, again, adductor muscles and the gracilis, and then the muscles of the biceps femoris, as well as the membranosus and tendinosus, but you can see the hamstrings group back here. If we look at muscles located in the leg, the fibularis longus causes plantar flexion and eversion of the foot. The tibialis anterior causes dorsiflexion and inversion of the foot. And then we have what are known as the calf muscles, or the triceps surae. They are 2 muscles again with 3 origins. But they all have a common insertion point, which is your calcaneal tendon or your Achilles tendon. And we are talking about the gastrocnemius, which causes plantar flexion of the foot. And then just deep to that is a flatter muscle called the soleus, which also causes plantar flexion of the foot, particularly when we walk, like when you place your foot down on the ground like that. That's a very important action of the soleus. And then flexor digitorum and extensor digitorum going to flex and extend the toes. So you can see here's your calf muscles, right? So the gastroc is kind of the fatter muscle, and then the soleus is just underneath that. The fibularis is here laterally. You can see the extensor digitorum here, tibialis anterior in the front of the kind of shin. You can see fibularis longus on the side, tibialis anterior, the soleus then in the back, and you can see extensor digitorum here. If we look posteriorly, you can see the gastroc muscles really well. It's got 2 heads, hence the triceps surae. You can see the soleus underneath. Here the soleus has been cut away, but they're going to have this common insertion through the calcaneal tendon onto the calcaneus here, and then the flexor digitorum posterior here, which is going to go all the way out here and allow you to flex your toes. And those are all of our muscles, or at least, well, not all of our muscles, as there's about 700 of them, but that's most of the major muscles in the body, and particularly important for you, of course. Those are the muscles that we're going to expect you guys to know.